Morning, Mark.
Good morning, Rob. You feeling good?
I'm feeling good. It's a Friday.
How about that weather? What?
Well, which part? All of it?
It's warm.
It is.
It was minus 100 a couple weeks ago.
Oh, yeah. I forgot about that. Yeah.
You did?
Well, I didn't have any pipes that broke, but no,
Yeah.
I'm kidding. Yeah. No, it was awful. I mean, that was ridiculous. You're right. And then
New
all
England
of a sudden,
weather.
Yep.
New England weather.
Mild. 60 for the high today, but not long. Then it'll be 19
Yeah,
tonight.
so bizarre. The swings are wild.
Yeah.
Wild swings.
Wild swings.
But grateful to be here. Grateful to wake up on this beautiful Friday morning and ready, 2 feet on the ground, and let's go, go, go.
Yeah.
Right into the weekend. And a lot, like you said earlier, a lot of people are moving on to the week. It's a long break for a lot of people. School's out. Was it Alice Cooper?
Yeah, school's out. Yeah, this time for the week.
Not for the summer.
Yeah, hold on, kids. Not yet.
Yeah, pump the brakes, kids.
But yeah, no, this is great when a lot of families get away, maybe getting up to the north, or maybe flying on out. As we had Jerry check in, Mark, and he says it happens every year. Logan Express in Braintree was full at 5:30 this morning.
I love it.
Yeah.
So they're all skipping school today.
You know where people are going out
so
today.
100% attendance out the window.
Maybe not
in exchange for a longer little break. I like it. Well, we've talked about people needing breaks, Rob.
Yeah.
A lot of people are already implementing the 4-day work week anyhow.
Yeah, I've heard about that.
Yeah. Yeah.
It's an interesting. Do you think that would be? I mean, obviously, the majority is still on a 5-day.
Yeah. You know, a lot of things still haven't changed, but at COVID, again, we talk about this a lot, you know, the positives of COVID positives. And, you know, the flexibility of the worker is so very important. And, you know, if you could get it done in 32 hours, get it done in 32 hours, right? But who's keeping track of every single hour? I think that that kind of mindset is on its way out. It's going to be more project-based and trust-based, right? You know, get your job done. We don't care. We're going to pay you a fair wage. And
the time clock?
Yeah. Punch the clock. Oh, my goodness. I hope that goes away.
Yeah, that's the time clock watches you. That's for sure.
Oh, boy.
I remember that from my retail days. Anyway, we're feeling good. It's a Friday, Mark Stiles. And what did you want? Did you want to start out with something about the Dr. Joe show?
Yeah, Dr. Joe enjoying his time away with his family right now. But we had a pre-recorded show yesterday. Super grateful to be on this show. I mean, I've been sitting with him live in the studio or on Zoom for a while now. I've learned a tremendous amount sitting with that brilliant man. And it's been super helpful to understand all of what he talks with people about. But we brought on 2 amazing guests yesterday. A fellow by the name of Morning Fox. He's up in Vermont, virtually changing the face of policing and the future of policing. And he was joined by none other than Chief Phil Tavares, who's doing that locally.
Really?
On the South Shore, really changing how people think about the police and what their roles truly are, rethinking the police, right? Rethinking, not reforming, as Dr. Joe loves to say. We're not reforming, we're rethinking.
Wow, okay. So you had both of them on the program last night, which is 8 to 9, and I imagine that'll also be available as a podcast.
So that's the beauty of it. It already is. So people, you could go to the podcast right now. Thomas already created this because it was pre-recorded.
Oh, that's right.
We pre-recorded a couple weeks ago, and it's now available on Spotify, iTunes, Apple Podcasts, all of it. But I can tell you it was an amazing conversation about where we're going with policing and integrating mental health social workers into those calls, right? So those distress calls, those first responder calls, having a mental health helper, someone who can reach out to that person on a different level, right? So they're not threatened by, I'm going to get locked up, you know, I better not say anything, as opposed to being in a different department, if you will, right? They don't have the Miranda warnings, right? They're, come here, let's talk about this. Let's, you know, sit down for a minute. Let's de-escalate, as opposed to, you know, the fear of losing your liberty, right? The police officers come, oh my goodness. I mean, obviously the police officers were called because somebody is causing some sort of disturbance, right? So whether they're going to hurt themselves or hurt somebody else, we need that police police intervention, right? But sometimes it doesn't work. So the thinkers, the big thinkers like Chief Tavares, thankfully grateful to have him in our community. He received a grant recently for the towns of Duxbury, Norwell, and Marshfield, so that they're going to have a person like that who's going to be responding to calls and helping, bringing those people to them. And you know, Chief does an amazing job as it is with his team. And you know, they said over 90%, 95%, I think they said, of all police calls revolve around some sort of substance abuse or mental health issue. So why not have people who are specializing in that available to mitigate what the situation might otherwise turn into? So they're doing this in Vermont. Every single state police barracks has somebody in their barracks going to calls with them. And he was telling us, you know, they go to car accidents, they go to everything because,
Really?
I mean, think about the trauma associated with that, smashing steel together. And I don't know if you've ever been in a car accident, but I was in a really bad one as a kid, and it's super traumatizing, right? So somebody who's there who understands the mindset of it. And I'm not saying the police officers don't, but that's not their primary focus, right? Their primary focus is keep everybody safe, right? So focusing on mental health, albeit they're being trained, and Chief again has certified them in this program, CIT, which is amazing. And I can't wait for him to share more about that. But he's trained all of his team with it. And I think it's going to help once that catches and becomes contagious, and other departments see it, and other communities see it, and people start to realize, okay, we've thought this through, and we may have found a solution here.
Wow, interesting. Okay, well, people can go and listen to that conversation, then it's already available on the podcast.
It is the Dr. Joe Show on Spotify, iTunes, Apple, wherever you consume podcasts. But Rob, don't forget, the MEF road race is coming up next month. MEF road race, the 5K. So our folks at Charity 365 have asked me to, again, highlight today, February, Alice's House. Alice's House is our focus. They're in Scituate. I told you at one point we were going to visit, and we did go and visit, and it's an amazing place. And we encourage folks to jump over to our social media platforms and learn a little bit more about Alice's House. We have a nice video on there with Janet talking about the mission of Alice's House. And next month is our focus on MEF and the cross-collaboration between public and private partnerships, right? So public can't do it alone. Private donations really help, and they raise a lot of money at that St. Patrick's Day road race on March 18th down in Brant Rock. Styles Law will be there with a tent. We've been there every single year, and it's an amazing environment. It's a lot of fun, and it's what I joke with my friends. It's, you know, let's determine how out of shape we are for the winter, because here we go. It's a nice flat 5K, walk or run, depending on how you're feeling. Tom Miller, thank you for putting this all together for all of us, and it's an amazing event.
Wow.
But we'll talk more about that next week.
Good stuff.